Smith. Smith is the
Yeah. Sorry?
okay. Smith is the boy you're
Yeah,
talking
Smith
about.
is a boy. So this is the scenario, and you will get 3 minutes time before entering into the exam hall. Then and you read in this 3 minute time
This
scenario.
okay,
That's this
and then
scenario.
I have to. You will be acting like
Uh,
the boy or
yeah,
parent.
yeah, like a boy or with. It's depend. It may in this scenario may they write here as a take focus history from Smith or Mrs. Sarah, mother of Smith. They will mention here whether
Okay.
you take history from Smith or her or his mother. So here is from Smith. So now I am acting as a Smith.
Okay. Hello, Smith. How are you doing today?
Yeah, doctor, I am not good because you know
What
my
happened?
yeah, doctor, my GP referred to you because of for last 2 days I had reddish color urine, and another thing I was suffering from fever and flu-like symptoms 7 days back. So my urine is high color right now, and it's scanty. So that's why I'm here,
Okay.
doctor.
Okay. So, you think you're not passing urine adequately?
Yeah, doctor.
Is it any pain during the passage of urine or burning?
Pain? No pain, doctor.
What kind of reddish color is that? Is it very dark or it is fresh red colored blood?
It's just red color, not dark.
Okay, fine. So do you have fever right now? Or it was the only 7 days back. Now you're well?
Yeah, no fever right now.
Okay, when you had fever last and flu-like symptoms, was it like sore throat as well?
Uh, yeah, doctor. Yeah, past 2 days it was very painful condition. Uh, then after
Okay,
2 days, it became gradually okay.
okay, it improved. Okay,
Yeah,
fine. Tell me if anything else you're feeling like associated with this reddish urine, like headache,
no headache, doctor.
and any blurring of vision.
No blurring of vision.
Do you have joint pains?
Right now, no, doctor. No, no joint pain.
Are you okay? No joint pains, and is the skin more red or itchy, or is there a rash over the skin?
Doctor, skin is all right now.
What about abdominal pain?
Abdominal pain. Doctor, it was just mild abdominal pain, but right now it's okay.
Okay, fine. Tell me about, has it happened ever before this episode that you got the reddish colored urine? Is it recurrent or it's the first episode?
Uh, yeah, doctor, this time it's the first time episode.
Okay, so should I ask about the investigations?
No.
You should take did you take any medicines
Yeah, doctor.
for you said you, yeah, yeah.
Yeah, doctor. As I mentioned that I was visited to my GP, and my GP prescribed me paracetamol and
Uh-huh.
advised to take plenty of water and one antibiotic for my sore throat.
Okay. Are you allergic to any of the drugs? Any allergies?
Uh, right now, no doctor, no allergy.
Allergies, or you are doctors have advised you to avoid any medication?
No.
Okay, fine. Uh, just a minute. Just a minute, Dr. Ravi.
Okay, okay.
Um,
Yeah,
uh,
you just take this history and then
okay, then I'll
other
have to go
history,
for the
other history.
family history. Is yeah is um
Yeah.
focus those past history as well, na? History of allergy and then family history. Anyone in your family have this kind of illness? Have you heard about it before?
Uh, no doctor, no family history.
Okay, and um, are you immunized? Immunization is up to date?
Yeah, doctor. Immunization is up to date.
Okay, so we should not, I guess, how can we ask about the development from the boy himself, right? And
Uh,
the nutritional status as well.
yeah,
We cannot ask it directly from himself, right? So what did I miss?
yeah. Here, puff binds bind to. So you
Uh,
need to take history about past history, any previous attack or not. Yeah, you did it. And allergy history,
okay.
yes. And family history is right. Birth history. So birth
Yeah,
history.
about birth history. How will we ask birth history from the child
Yeah, yeah,
himself?
it is not possible. Then immunization, yeah, it is all right. Nutritional history is,
Yes, in nutritional history, I can ask,
mhm.
what do you like to eat most of the time? Are you allergic to any of the foods?
And your
Or,
appetite is all right or not.
okay, yes, appetite. Yes. And how about AGNA? It's not involved in nutrition much.
Hmm.
AGN. Uh, and in development, we don't need to ask much. In drugs and medications, I asked.
Hmm. Development, yeah, just your development, your you, what should ask, your development regarding your walking, speaking is all right or not.
Okay.
And it is appropriate when his mom with him. In that case, you have to ask, is Smith's development is all right, like he is walking. Uh, what? Okay, so mom, do you have any concern regarding the development, uh, like walking,
Okay.
running, speaking, smiling of your child Smith? So in this way, so you have to ask, do you have any concern regarding the
Okay.
development process of your child Jack, like walking, running, speaking, or vision? So if she
Okay.
has any concern, she will, yeah, doctor, yeah, then. And another nutrition, nutrition history. Have your GP shown any concern about your child height and weight? Like here is
Okay.
anthropometry, actually the, nutrition and anthropometry. Yeah,
Nutrition and anthropometry. Okay, we
anthropometry,
can write that.
anthropometry. So any concern about height and weight? Then your GP shown any concern uh, about child growth chart? That means does your child growing nicely along the growth chart, growth curve? Is it or not? So these three questions. So first you have to ask, uh, have your GP shown any concern about Mr. about Smith's development, uh, like height and weight. Oh, sorry, nutrition, right? Uh, have your GP shown any concern about Smith's height and weight? Have your GP shown any concern about Smith's growth chart? Does Smith growing nicely along the uh, growth curve or not?
Okay.
These three questions.
Okay.
Then
Uh, uh-huh.
then
Fine.
development is finished. Then drug. So is Smith taking any medication right now? So
Mhm.
you asked it in previous question, previous part here.
Yes. It was because I wanted to rule out some differential diagnosis now.
Hmm.
Maybe there's
Yeah,
some
yeah,
bradycardia or
yeah.
GCD or
First thing you have to ask a history of present illness. So history of present illness, then uh, history of present illness here is hematuria. So you details about hematuria onset. First is onset. It is uh,
okay. Mm.
insidious or sudden onset. So onset is first thing. Then duration from for how long. Then OCD. Then course. You can ask course later because here is investigation and treatment. Is he is taking any other treatment or not, or have he seen any doctor or not, then any
Okay.
investigation done or not, this. Okay, then duration, then another thing is OCD, that means
Okay.
that means onset,
Onset, course,
course,
and
and
duration.
duration. Then
Okay.
RSI. RSI means হচ্ছে relative systemic inquiry. So relative systemic
Okay.
inquiry here is your abdominal pain. Is pain is present or not? That means UTI. You ask pain for UTI, na?
Yeah, yeah.
So color it depends on it hematuria or hemoglobin urea or altered
Yeah, cola colored
coca
liver.
color, coca color, cola color. Yeah, fever for yeah,
UTI again.
UTI.
UTI and cystitis and
It is.
yeah, and pyelonephritis. There can be many.
And you ask headache for blood pressure, na? Or
Yeah.
hypertension, blurring vision for hypertension, joint pain for SLE, is it?
And HSP.
And
And HSP.
HSP, and skin for SLE and
Yeah.
HSP and SLE, mild abdominal pain for HSP, then recurrence is lupus nephritis or other nephritis.
G6PD, G6PD, any bleeding disorders? I asked for about the skin rash as well, na? I
Mm-hmm.
asked about the rash for any bleeding disorder. We have to rule out bleeding disorders as well.
Bleeding disorder, yeah, bleeding disorder.
And for recurrence also, there can be G6PD, that can be hemolytic anemias. No, the autoimmune hemolytic anemias can cause uh,
Mm.
hematuria
Uh,
and bleeding disorders. All of them cause recurrence. And there are other glomerulonephritis also.
yeah,
That is
also
for
can talk.
recurrence. Like,
You need to
yeah, like
ask
IgA nephropathy. IgA
hearing,
nephropathy.
yeah, hearing
Yeah,
issue,
fast. Hearing. Yeah,
eye issue,
hearing.
eye vision, any vision issue, visual problem,
Okay.
then hearing problem, uh, Another thing is here is family history. You have asked here family history. Anyone? What is family or family history? Yeah.
Do we need to ask about consanguinity or something in family
Uh,
history?
yeah. In case of Alports, it is not Barzars. That means IGN appropriately is X-link, na?
Yeah.
Mostly X-link or what?
IGN
Barzars
nephropathy.
is Barzars is mm, oh yeah is X-link. Alports is X-link and autosomal recessive.
So we
Dominant,
autosomal
autosomal
recessive.
dominant.
We have to ask about consanguinity.
Yeah, consanguinity. Yeah, you have to ask about consanguinity. And then, yeah, so you, uh,
Allergy to some medication can also cause
medication.
hematuria.
Yeah, allergy
And
is here. Allergy.
yeah,
There is
I
past
asked
history.
it previously here.
First is past history, then allergy, then family history, then birth history. Birth history in this case here is nothing, but
Okay, should we skip birth history in AGN?
no, no. If Smith, here is Smith, but if here is Sarah or uh, or, another female like Faria, so mom, mom of mother,
Mom or dad, anyone?
mother of
Then you
yeah,
have to ask.
mother of Smith, then you have to ask everything. So
So you gave us a few questions. We can write down here that we have to three questions about nutritional and anthropometry. These were number one. We can write them
yeah.
in bracket or something. One we have to
Oh, question. Yeah,
ask
question is
concern, GP concern about height and weight,
height and weight.
and then is any GP concern about the growth curve that the
Hmm.
child is growing along the growth curve, and what was the third?
Growth curve, and another one is height and weight growth curve, and another any concern about growth chart, curve line growth curve
Yeah,
is
these are two, no? These are two, height, weight, growth curve. What is
only
the third
yeah,
question? You
basically
said,
two, height, weight, and growth curve.
okay.
But you can ask in three form. Is Smith's height and weight is all right? Is have your GPA shown any concern about height and weight, or have any concern about growth chart, or your child following nicely along the growth curve?
Okay.
And regarding development, do you have any concern regarding the development process of your child, like walking, uh, speaking, then
Yes, walking and speaking and
hearing, vision,
yeah.
everything?
His performance in school, maybe.
Oh yeah, yeah. So this is three. Then you have to come here. If your if this patient is more than 10 or
Adolescence.
adolescent.
Yes, then what do we have to, what is SS? SS.
Yeah, wait. Okay, so if he is adolescent, in that case, head S. But if he is school going, then only S. So school going is school history, and okay, wait. And what? Oh, school and total
Okay.
socioeconomic history. So in head it is uh, what is head? I forget this head.
Yeah, I don't even know. So,
It is
what is head?
adolescent, not 10 years. Um, EAD. D is drug, S for sexual, S for psychological, and does your social. Another one is social.
And what about head?
Yeah,
Head.
this I forget.
Okay.
Is in mark or not? Mark BG.
Okay. No, I have no clue.
Okay, so tomorrow I will clear it. So another thing is then you have to ask about what investigation you want to do. So
Okay,
investigation.
I have to ask. Okay.
So investigation.
So investigations, I'll tell that to the examiner that I would like to go for.
Actually,
I would.
actually the attendant was examiner.
Yeah. So now I would like to investigate the patient with the urine routine examination and blood pressure monitoring, um, along with the ASOT titers and T-streptolysin O titers. And what else?
Everything you have to exclude all
Okay.
DD.
Hmm.
First is complete blood count.
Okay, so come from okay, complete blood count.
From
Then,
mm,
then if we're going to do ESR,
uh,
CBC, ESR,
full
ASOT,
yeah.
urinary, urine culture,
Mm,
then urine for nitrates, I guess, and
urine for nitrates. That test was in strip maybe in UK. There, yeah, in strip
yeah,
test.
that is. Hmm.
So first thing you have to
And
do urine routine and culture. Here you can find dysmorphic RBC more than 30% or mild proteinuria can be found. Then complete full blood count with peripheral blood film. Then yeah, streptococcal infection evidence, that is throat swab and culture, and ASO titer. Anti-DNSB you can do, and
yes,
then you have to do other test to exclude DD like C3 C4. Then urea creatinine electrolyte to see the any progress of the disease, any stage of AKI, and X-ray. X-ray is not mandatory here. So this test.
no, no,
Mm.
no, no.
But
X-ray is not.
and if you suspect uh, your history,
Ultrasound KUB.
yeah,
Yeah,
ultrasound of KOB, yeah, ultrasound of the KOB, and another thing is renal biopsy. If you suspect it's a Alports or IgA nephropathy,
IG.
or recurrent atypical features of glomerulonephritis, in that case you can do, yeah, renal biopsy. So how
Okay.
you will treat?
So, so what do you call it? Symptomatic management
First,
or
supportive,
conservative management?
uh,
Supportive, yeah.
supportive management and supportive management, then specific management and treatment of complication. So supportive means here is bed rest to increase renal perfusion, then salt and water restriction, protein restriction, avoid potassium containing fruits, and antibiotics definitely to eradicate group A streptococcus. Antibiotic usually uh, phenoxymethyl penicillin, but I don't know about UK protocol. So you have to read this from pediatric guideline,
Okay, okay. Yes, we should.
AGN. Yeah.
So, pediatric guidelines again.
Mm.
Okay.
Then treatment of complications. So if you found any hypertension, then treat according to the cause or according to the severity. It may be need simple diuretics, or it may be need injectable antihypertensive if any hypertensive crisis or urgency or emergency in that case. So another thing is if uh, renal parenchymal disease with hypertensive crisis, in that case treatment. Or another thing is hypertensive encephalopathy, important. If any sign symptom of hypertensive encephalopathy, then you have to give again injectable antihypertensive with diuretics. And important complication is hyperkalemia, huh? In ASEAN.
Yeah,
Mm.
AGM due to kidney injury.
Mhm. Okay, so next is prognosis and follow-up. So this prognosis, it is in Nelson, it is 95% resolution, 1% CKD, and 1% persistent azotemia. And follow-up schedule, we have to read protocol of UK. So basically, hematuria patient came with hematuria. How you proceed? Take history. So first 3 minutes outside the room for your preparation. Then 4 minutes uh, you you will take history. After 4 minutes, examiner will warn you. It's 4 minutes. So another 5 minutes you have. In total 9 minutes. After that, examiner will ask you question, cross question like investigation, treatment. Another 9 minutes. So 9, 9, 18 plus 4 or 3. This 22 minutes.
Okay.
Okay, this.
Okay, so this is the history.
Hmm. This is the history. So history tomorrow I will read more and I will discuss headers and another thing, other point. What type of history come in the exam.
Mm.
So another class,
Yeah.
Made Pro. Maybe today they have free class.
Free class?
Yeah,
Okay, when? What
just
is the time?
15 minutes. After 15 minutes, I'm sending the link.
Oh, yes, send the link. Let's try. See.
Hmm, free class, yeah.
Oh, till then we can read AGN from pediatric guidelines. Can
Yeah.
you send the pediatric
Mhm.
guidelines again
Okay, okay.
to the group?
Okay. Group, na? Pediatric guideline. Maybe in this year it may be changed again because it was 2022-24. We have to read another new guideline.
Okay, doesn't matter. It's like
Life is.
there must not be many changes.
Yeah, I know it. Not so many changes. So they will discuss communication. So meeting time is finished. So are you want to join again or next class? Hello?